There are 5 different tooth-saving methods. When we look at the surgical options, the first one addresses inflammation at the tip of the tooth root. A root canal was tried, a root canal retreatment was tried, whatever the case, we go in through the gum with pinpoint accuracy to remove the inflammation at the root tip. 2/3 of the tooth's root is healthy, the tooth itself is healthy, it's an operation with a 60% chance of success. That's the first operation. Moving on to the second operation, there's a procedure we call reimplantation. This is where the tooth with the inflamed root tip is extracted. Then, that inflamed area at the root tip is removed and cleaned, and the tooth is placed right back into its socket. It's then stabilized for about a month by securing it to the adjacent teeth, and the patient has an 80% success rate for being able to use it, their own natural tooth. You see, again, we're focused on saving the natural tooth. Third, there's a method called hemisection. This means a tooth might have 2 roots, for example. One of these roots is damaged, it's inflamed, but the other root is healthy. That one damaged root is removed. The existing healthy root remains, and a new tooth is built on top of it, just like a natural tooth. It's another one of the tooth-saving methods, and it's a procedure with a 90% success rate. So, let me mention one more. Tooth transplantation. For instance, let's say you've tried all the methods and had to have the tooth extracted. You had the first molar extracted, for example. If the wisdom tooth in the back, a tooth that's barely used, if at all, if that wisdom tooth can be extracted intact and meets certain criteria, it's placed into the socket of the extracted tooth. See, once again, we're talking about saving a tooth, another method for preserving a natural tooth. And finally, as a 5th tooth-saving method I can mention, there are some patients with destructive gum disease. I actually touched on this briefly earlier. It both dissolves the jawbone and causes gum disease. And it's a genetic condition, this gum disease, that appears at an early age. If those tissues around the tooth roots are addressed at an early age with precise interventions, with a good operation, working millimetrically to remove those tissues, the bad tissues, let's call them destructive tissues, that can also be considered a tooth-saving operation. And I'm talking about a procedure with an average success rate of 93%. Therefore, from saving a tooth from a crown or an implant, I mean, whatever methods and operations exist to protect and save a tooth should frankly be used.